Okay. TomoTherapy is a revolutionary way of delivering radiation to treat cancers. It uses intensity modulated radiation therapy, and thereby it is different from conventional radiation. And this system actually allows you to locate the tumor which is deep-seated within a patient using a CT scan before each day's treatment. This therefore allows for accurate positioning, and then subsequently when that is ascertained, you then deliver radiation into the target precisely. This therefore then allows for confidence in delivering high dose into tumor and also reducing the dose to its neighboring normal tissues. In conventional treatment, you usually would employ a few beams of radiation coming in from a few limited angles because of the consuming time in planning when you employ too many treatment fields. At the same time, that will increase setup time. Whereas in TomoTherapy, there is an unlimited option of beams direction. You can actually deliver technically from 360 degrees, and this therefore allow unlimited options in shaping the radiation to conform to the irregular target where the tumor is. In intensity modulated radiation therapy, you are able to vary the radiation in different parts of the body. And so even if there are sensitive structures next to the tumor itself, you potentially can lower the dose to the normal tissues without compromising on delivering a good optimum dose to the tumor. And in that way, we actually make radiation more effective in terms of tumor control, and at the same time safer in terms of cutting down on the side effects. Okay, I think it's not just in terms of patient where they reap the benefits of this treatment. It also makes delivery of the radiation safer in terms of cutting down errors as well. Let me elaborate. First, with respect to the system itself, you actually have a facility within this equipment to perform a CT scan, and that will allow us to locate the tumor, compare the position in each day's treatment. There is a computer and its integrated software for complex planning, and this all within the same system then cuts down the transfer of data from one station to the machine and then the carrying out of treatment. Therefore, that actually cuts down on the possibility of errors. Now, it is a complex system, and therefore you find that in terms of the planning in this integrated system, the treatment planning time actually is reduced compared to some of the other vendors' equipment in terms of doing IMRT. And therefore, actually we can reduce the amount of staff time for treatment planning. Now, I would not recommend TomoTherapy for every tumor that is to be treated with radiation. We would judge whether a simple method such as conventional radiotherapy would suffice. If it was in an area where complex treatment planning is required, if it is an area where imaging to ascertain that you are accurate in delivering the radiation, to take into account its patient's organ movement, for example in the lung, a prostate for example, where it may vary according to bladder filling and rectal fecal filling. These are tumors that in locations which would benefit from TomoTherapy because you can ascertain that they are in the right position each day before you deliver the radiation. So good examples for treatment using TomoTherapy would be in the brain, in the base of skull, head and neck region, lung, pancreas, and the prostate. Now another group which is very good candidate would be spinal tumors, primary tumors where you have to deliver very high dose, and at the same time you want to make sure that the spinal cord itself gets very low dose, and that is it. And some metastatic, in other words, cancers that spread to the spinal bone, where it's close to the spinal cord, you may have to employ it, especially in cases where we may have to retreat them. Some patients had already have radiation to the vertebra, and therefore the spinal cord would have been compromised. And in some of these patients, they would benefit from getting radiation a second time without over-treating the spinal cord.